this is Dr. Eisenbrown. I'm here to answer some of your questions about the common urology problems that we see. Now, what do we do to treat pelvic floor dysfunction? In the old days, we used to dilate women's urethras. Some of you may have had your urethra stretched when you were younger or dilated. That's kind of an old-fashioned way to treat it, but I understand how it works and it does make sense. If you have a muscle that's in spasm, how do you break it? I get Charlie horses in the middle of the night a lot, so when I do that, I pull on my toe to try and break that spasm. If you have a circular muscle, the way that you would break that spasm would be just to dilate it and stretch that muscle. The reason I don't like to do that is, number one, it hurts and nobody really wants to have something done that is painful, plus it can actually harm the urethra and cause scar tissue. I prefer to use medications, which I think is a kinder, gentler way to treat the problem. I have to use two medicines, however, because they're different structures. The sphincter is made of skeletal muscle, so it's like your bicep, and I need to use a muscle relaxant for that. For the bladder neck, it's made of smooth muscle, so I use a alpha blocker there. In fact, the medicine I use is called Flomax. Flomax was actually invented for men who are obstructed by their prostate, but it actually doesn't do anything to the prostate. It blocks receptors along the bladder neck that push the prostate out of the way. So we women have the same receptor and it works on us as well. But I always like people to be aware of that, because with the era of Dr. Google, if you look it up or if you read the package insert, you're going to see that it was invented for men, it's for the prostate, and it's not indicated to be used in women. But don't worry about it, we use it in women all the time. We also use it in people who are passing kidney stones, because we know that it not only does it dilate the bladder neck, but it dilates the urethra, the ureters as well. The second medicine I have to use is something for the sphincter. The medicine that I find works best is a very low dose of Valium. Just 2 milligrams before you go to bed is enough to relax the sphincter so that the spasm will break without making you sleepy, sluggish, or tired during the day. If you have pelvic floor dysfunction and you take these medicines, you will notice an improvement in your flow within the 2 to 4 week time frame, which is why I generally bring people back at a month so that we can reassess and see if this really helped your problems. Thank you for your attention, and I really hope that this has been helpful. If you have further questions, please don't hesitate to ask me when we see you in the office.